Welcome back. September is Ovarian and Prostate Cancer Awareness Month. And joining us live in Studio B this morning is Dr. Ravi Patel with the Comprehensive Blood and Cancer Center. Doctor, thank you so much for joining us this morning.
Thank you, Grace.
Thank you. So happy to have you here to really share some good information with the community. Let's begin with ovarian cancer. Today is Teal Talk Day, encouraging people to talk about ovarian cancer. Can you share how curable is that disease?
You know, the great thing about ovarian cancer is that there's a lot of research going on in it. The surgery which is done for ovarian cancer, people in the past had to have big incisions. Now they can do robotic surgery, so it's minimal incisions. If you pick it up early, remove it, your chances of cure are excellent. Now, say for some reason it has progressed and come back, don't get discouraged. There are more drugs today available for ovarian cancer than they were available a few years ago. The ovarian cancer has certain mutations, and there are drugs which target those mutations, so a lot of good options for patients.
That's good to hear. And you mentioned early detection. Can you share for ovarian cancer and prostate cancer, if you'd like, what are some signs and symptoms for people to look out for in themselves?
So very important, prostate cancer has a marker which is called the prostate-specific antigen. So it's a good idea for men to get the PSA done at the age of 45.
Okay.
If you forget it, 46. But between 45 and 50, get it done.
Okay, good to know.
And if you do the PSA, that's a blood test which tells you something could be going on with your prostate, and you can get a biopsy.
Okay, and what about those symptoms for ovarian cancer?
So anytime you get any abdominal discomfort, if you find that you're getting bloating, just be sure you check up with your OBGYN. And it's always a good idea to do your regular checkups with your OBGYN, because they can do the pelvic exams, they can make sure that they're doing the blood tests which are needed to pick up any signs of ovarian cancer. And if you have a family history, it's very important to follow up on that.
Yeah, that family history, of course, super important. And we were talking earlier about how you have something exciting happening with the CBCC and UCLA really partnering up together. Can you share some more about that study that's happening?
Yes, so we currently we are doing quite a few studies with UCLA. We are doing one for lung cancer, another one for breast cancer, and another one for prostate cancer. But patients can call us. We have our clinical research department. Even if we don't have a trial, we can guide them to where to go for which trial. But for all of the major cancers, we do have trials going on with UCLA. And they do not need to travel to UCLA for those treatments. They can get it right here.
Fantastic. That's really good to know, especially with the travel aspect.
It's very difficult. Yes.
Certainly, on certain days as well with the traffic, very unpredictable.
Yes, yes. No, they can get everything here.
That's good to hear. Yeah, right in the community. And speaking about, prostate and ovarian cancer, understanding people's genetic history, we touched on this briefly, but can you share more about how important it is for people to know their family history when you're going in for these checkups?
Yeah, very important, and it's very critical that you communicate that to your primary care physician or a cancer specialist, because certain cancers are familial. Certain breast cancers, certain colon cancers, ovarian cancers are familiar. And nowadays you can do what is called a panel of genetic testing, where you can just take a sample of your blood and test for all hereditary genes in that. So it's an easy way to do it. If you have a family history, we actually have a genetic counselor at CBCC who can guide you through what blood tests need to be done, and then when the results come back, to connect you with what those results mean and what precautions you need to take for your lifestyle, monitoring, variety of things.
That's great to hear. Well, we'll have to have you back on to talk about that genetic aspect as well. Again, thank you for being here and joining us this morning and sharing those resources.
Thanks for joining our community.
Oh, thank you.